Hi, I'm Jason Odegaard with OKC Kids Urology, licensed marriage and family therapist. Here today on a bit of a kind of interesting, lighthearted topic, hopefully, but also serious at the same time. I wanted to talk to you guys about how not to go crazy during very long surgeries. I know that many of these surgeries, when we have a kiddo with bladder exstrophy, they can be 6, 8, 10, 12, even longer hours. What do you do as a parent? What do you do as a parent with possibly other children to occupy your time during that time while your child is in the operating room? So I wanted to come up with some ideas and things for you guys to think about when it comes to preparing for those surgeries. And so this video is just to kind of address those things. You guys do a lot of preparation and planning as far as where you're going to stay, things you need to bring, how you're going to help your kiddo after they come out of surgery, how are they going to be entertained and distracted and not focus on the pain or the fact that they can't move, that they're in the hospital for an extended period of time. So I wanted to talk about how you as a parent can avoid going crazy as much as you trying to prevent your child from going kind of crazy. So while they're in surgery specifically, think about the different places to go and things you can do. I know that anxiety keeps us often stuck where we are. There's such a term we call as analysis paralysis, where we think so much about the things that we can't control and that are outside of our power, and it causes us to just remain stuck where we are. So one of the things that we do at OKC Kids Urology is I provide a list of different places to go and things that you can do in the local area that are all within just a couple of miles of the hospital, so that you can get out of the hospital setting. We all know just sitting in a waiting room at a hospital setting can be just stressful in and of itself, just by sitting and waiting, playing on your phone, watching whatever's on their TV. And maybe you can do that for 20 or 30 minutes, but after a short period of time, if you're like me, your attention span just kind of goes nuts and you need to move around. So what I do is I like to create a list of 10 things that I give to our patients, with addresses and things that are around the area. So again, that's one way to think about it. Another way is just to think about, where do I put my anxiety? Usually our anxiety can be best limited if we put our energies into things outside of ourselves, right? Because if we're just sitting doing nothing, we tend to always fill time and experience of the unknown with worst case scenarios. So for example, just sitting in the waiting room while your kid is in the operating room, you might be thinking about it, you might be praying about it, you might be hoping it goes well, and all those things. And often that causes rumination, where we just keep thinking and thinking and thinking and worrying, and our stress doesn't help. So best thing to do is put that energy into something else, whether that's going to your local coffee shop, getting a bite to eat. Again, these are all limited time experiences, but even taking a laptop or an iPad, binge watching your favorite show, calling a friend, even going to other things in the area that you might not do. You go to the movies, go to other things. Now again, I know as soon as I said go to the movies, all of you said, well, what happens if my doctor calls me in the middle of the movie theater? Well, that's fine. You should definitely take that call and make sure everything is okay. But you can also leave the movies if something happens. And again, if you're 5 or 10 minutes away from the hospital, that's okay. It's pretty easy to get back there. So again, the goal is for you to maintain your sanity and to be involved in something outside of yourself that takes your attention, your energy, your time. And I know it might be challenging, but even if you went to a movie that was, say, high energy, an action movie, for example, that consumes some of your attention, I mean, that's 2 hours right there. That's going to take away the stress that you might have just sitting, again, scrolling through Instagram or Facebook. Again, this is just something to consider wherever you go, creating a list of 10 things, whether they're big or small. Like I said, coffee shops, movies, go play laser tag, go play mini golf, go drive a go-kart. I mean, whatever comes to your mind, whatever you can do with your other kids, just to consume that time and put your focus into other things. Again, anxiety often comes from looking too far in the future or too far in the past. If we stay in the present, that often helps us stay calm, but at the same time, your present is going to be one of stress, because in the present, your child is in surgery, right? So that's why I say getting outside of yourself and thinking outside of your experience, like, playing a video game or getting involved in something that requires high focus, that will benefit you in the long run. So these are just some tips from you. This is Jason from OKC Kids Urology. Keep thinking outside the box. Think of other things that you can do that are creative and fun and require your focus, and that'll just help the time go by a lot faster.